Hi, everyone. Thanks for being here. Yeah, we're really excited to talk about this project we've been working on gender and emergency management here at the Center of Excellence for Women's Health. So it is Emergency Preparedness Week, and it is also Gender-Based Analysis Plus Awareness Week. So it feels like a very good time to be discussing this topic. And actually, if you are based in BC, as I am, we actually have an emergency alert test today. So all very fitting. I am Ellie Huber. I am the Knowledge Exchange Lead at the Center of Excellence for Women's Health and also a researcher. And I was the project coordinator on this project. And just to let you all know, we are recording today's session. So we've turned everyone's videos off for the purposes of that, and we will be sending it out to you all in a follow-up email. And as we go along, please feel free to add comments in the chat, or if you have questions, there's also the chat function available to you there to add questions. So thanks so much. So in this next hour together, we're going to introduce ourselves at the Center of Excellence for Women's Health, if you're unfamiliar with our work, as well as introduce the project overall. And then we will dive into a discussion of the project activities and methods. And then we're going to present the Gendered Emergency Management Framework, which we developed, and then explain some of the next steps we're working on as we wrap up this project. And then there will be a little bit of time for questions at the end. So the Center of Excellence for Women's Health is a virtual research and knowledge exchange center, which is dedicated to improving women's health and promoting gender equity. The center has over 25 years of experience collaborating with researchers, service providers, policymakers, and community-based advocates across Canada and on various health and social justice topics. We have expertise in sex and gender-based analysis plus, gender transformative approaches, and trauma-informed practice. And in 2024, we were really grateful to receive funding for a one-year project through the Chief Public Health Officer Catalyst Grant from the Canadian Institutes of Health Research. So there were many people involved in this project, and from the Center of Excellence today, you're going to hear from Dr. Lorraine Greaves, our senior investigator, and Carol Munoz-Neves, a researcher on this project, as well as myself. And unfortunately, our director, Dr. Nancy Poole, couldn't make it today, but she's been integral in this project as well. Our project partners are listed on the right, and they have diverse expertise on this topic. So we were lucky to have folks from Royal Roads University and JIBC, Justice Institute of BC, which both have emergency management education programs. So Bettina Williams is the program manager at JIBC, and Dr. Jean Slick is a professor emerita at Royal Roads and leads research on gender and emergencies here in Canada. And then Suzanne Hawkins and Nikki Legg have been involved in provincial level work to include gender and equity in emergency preparedness and response in Newfoundland and Labrador. And then finally, we were lucky to have some folks from Gender and Disaster Australia help us along the way in this project, and they are really internationally recognized as leaders in this area. So we're so grateful to all of them for all of their help on this work. And so next, I'm going to turn it over to Lorraine to speak a little bit about the project.
Thank you, Ella, and welcome everybody. This is clearly an opportune week to be discussing this blend of issues, gender-based analysis and emergency management. Our objectives in this entire project were three. One, to build awareness about these issues and how they interact. Two, to develop a framework, which we'll hear a lot about today. And three, to hopefully establish or re-establish a network in Canada of interested parties. And we'll talk about that a little bit at the end. So what did we do? As mentioned by Ella, we are in response here through this funding opportunity to the Chief Public Health Officer's 2023 report, which was really about how we could do better in Canada to create more resilient communities in the face of emergencies that will be upcoming, undoubtedly. And the scope of that was quite broad. And the focus of that was to generate some better approaches, essentially, to health promotion and planning that would render communities and individuals in communities much more resilient to what may be coming down the track. And in our case, we wanted to focus on the issues around sex, gender, and equity and how they may, in fact, have an impact on all of these questions. So we did some evidence reviews of both academic and gray literature. And this was primarily to find out what exists out there with respect to evidence on these issues of sex, gender, and emergencies. Then we consulted with researchers, officials in the emergency management area, consultants in the area, various NGOs focused on women's health, leadership, and emergency management, communicators, policymakers, and as mentioned already, our partners were extremely important to our thinking, as you will imagine. I just also want to shout out all the people who consulted with us along the way. They really had a huge impact on our thinking and how we evolved the framework. Then what we did to do that, we sort of generated some themes out of the literature and began to think about how we could make a picture of the key issues. And that was the beginning of the framework development. We iterated that amongst our team. We shared it with our partners, and then we shared it more widely with our consultation partners. And we had 2 consultations with a wide range of people from across the country and some from Australia who commented and made our document and our diagram much better. And now we're in the knowledge mobilization phase, and we're going to continue to be in this phase for some time to come. So that's basically what we've done in one short year. So the bottom of the framework is really based on applying an iterative sex and gender-based plus analysis in not only examining the evidence, as I mentioned, but also trying to figure out and speculate a little bit about how what we know in the evidence might impact emergencies and disasters. And therefore, how we can incorporate this kind of thinking into our planning going forward, no matter what sector we're in. And we created the framework to really speak to all sectors who are involved here. And when we say iterative, we mean that SGBA Plus is an ongoing process. It's not something you do just once. It's something you continue to do and get trained in doing and share that training and those ideas with colleagues. So using that as our base, we examined the academic evidence and asked this question: how do sex and gender matter in emergencies? This is a diagram just sort of categorizing some of the things that we found in the literature around gender. And in our work, we categorize aspects of gender into these 4 main areas, which are kind of arbitrary because these things always overlap in real life. But they help us try and figure out what is actually making a difference in an impact or in a response to an emergency. So you'll see here, for example, identity issues, gender identity issues have an influence. And that means, for example, one's commitment to traditional femininities or masculinities can influence how you actually seek help, how much caregiving and risk-taking you might be doing, and how that influences how you react in an emergency and how emergency management personnel react to you as a group. We certainly have seen on that same theme that much stricter adherence to traditional feminine or masculine gender roles is associated with poor mental health outcomes following disasters. We've also seen in the institutional area that policies and priorities that are set in advance for planners or policymakers have a huge impact on the structural factors that affect the impact of disaster on various gender groups. And that could be things like funding, training, housing protocols, whether or not services such as emergency services for survivors or victims of gender-based violence are considered essential, and whether or not they're funded and maintained during an emergency, for example. And then last but not least are the more gender relations area, where we often see the issues around power sharing and decision making come to the fore in who gets to make decisions or takes decisions in an emergency, and whether or not those kinds of issues around gender relations play out. One of the things we have noticed, and there's an entire subset of literature on this, is that in emergencies, gender-based violence increases. So that's just one example of how gender relations manifests. We also looked at sex, and again, we've categorized these issues arbitrarily in 4 areas, looking at various aspects of the body: physiology, anatomy, biology, genes, hormones. Again, these things overlap, but it helps us sort out some of our evidence that we were reading about. And the examples here, by and large, focus on issues around maternal stress during disasters and how that may play out with respect to cortisone, and whether or not stress responses change, how it plays out in terms of impacting a fetus during a disaster who experiences maternal stress that way, and what the manifestations are for that fetus in terms of eventual brain structure. And then also issues of PTSD. We know, for example, even though the literature on the sex-related area is very complex and clearly needs much more development, we do seem to see over and over again that females experience more PTSD. So those are just 2 kind of structural ways in which we've categorized the amount of evidence that we found. But of course, as we move on, we realize in real life, sex and gender interact in real life with a whole lot of other issues. Intersectional issues around factors and characteristics of populations, roles such as some I've mentioned, but essentially caregiving and elder care roles, occupational roles, and those kinds of issues have a huge impact on what happens to a person in an emergency. And when I say what happens, we're talking about things like mortality and morbidity. We do know, for example, from a variety of sources, that in many kinds of natural disasters and climate events, more women and children seem to die compared to men. And there are multiple complicated issues around why that is true, but they can be issues such as focus on caregiving or elder care and being slower to respond because of those issues. It can be around occupational roles. The tsunami in the Indian Ocean is such a good example of some of these impacts, where that tsunami killed many, many women and children on the beaches or on the shorelines who were unable, for a variety of reasons, to get away from that water. And many men who were perhaps fishers, and that's an occupational role having an impact here, were already out to sea, had gone out earlier that morning. Some of the other issues are dress and mobility and cultural issues that have an impact on whether or not women make decisions or whether they wait for others to make decisions. So these are pretty complex and subpopulation oriented, but just to let you know that there's a huge selection and integration of issues that mix together in real life, along with the sex and gender issues, to create inequity or equity in terms of the response to an emergency. So we looked at all that evidence, and then we thought through some of our other work on related issues. For example, we did a project during COVID on the impact of COVID and other pandemics on issues around substance use and gender-based violence. And we realized that there were, some key approaches that we use in other ways that really did resonate here. One of which is gender transformative. And what we mean by that is that we take an approach that has the dual goal of improving emergency management along with improving gender equity. So, gender transformative approaches to health promotion always have dual goals. So, we might be, in this case, trying to lower mortality, lower morbidity in an emergency, but also at the same time trying to improve gender equity, and specifically in this case, to improve the status of women. Taking a trauma informed approach seemed really obvious to us in that experiencing an emergency or disaster is inherently traumatic. And so we're thinking that taking that approach is super important. And we'll just show you the next diagram, which illustrates the principles that matter here. And that is when we take a trauma informed approach to anything, we assume it's a universal approach. It's not about individual trauma, it's about collective trauma. So we try and integrate as much choice and collaboration, as much social connection, as much safety, and as much strength based skill building that we can in our response. So, just going back one slide, we'll see that when we take both gender transformative and trauma informed into account, we end up, we hope, with more of an equity oriented approach. And so, consequently, these three streams of thinking, prioritizing those most affected, actively seeing that disparities are acknowledged and factored into the planning and the recovery and all the other phases of responding to an emergency by constructing tailored programs or policies is essential to sort of evening out the impact of disasters and emergencies as best we can. So that's a lot. And that took us several months to sort that out. The evidence from both the academic sources and the gray literature sources is, as I said earlier, incomplete, and in some cases, not conclusive. So we are working our way through some of those themes still. But we certainly could use examples, as you've seen already, from those literatures to inform our framework and our diagrams. And those diagrams and framework will be incorporated in the report that we release later on in June of this year. So, having said all that, Ella will take over from here.
Yeah, thanks so much, Lorraine, for introducing those key ideas. So yeah, as Lorraine said, we looked at the literature and the gray literature, and we thought about these key approaches that are so important to so many issues, and really saw how they applied to emergency management. And so this is the diagram that we developed, and this was, again, through an iterative process internally with our team, as well as with the guidance of our project partners and folks who were involved in our 2 consultations. So the GEM-F is really, this diagram really illustrates a multifaceted and multi-step process for assessing planning, policy, and evaluation of emergency management. And so you'll see some of the key things that Lorraine spoke to here. But first, the diagram really first acknowledges the impacts of determinants of health, including biological, social, and economic determinants of health, both on an individual level and on a collective level, and including all types of emergency situations. And so underpinning all elements of the diagram is sex and gender-based analysis plus, which Lorraine really spoke to. And it illustrates how important this process is at every stage. And so we really see that data collected to support emergency management really should be sex and gender disaggregated so we can have a better idea of what the vulnerabilities and risks are, as well as the strengths and where the resiliency is. And so we would also like to see data that's disaggregated by these other intersectional factors, such as age, race and ethnicity, ability, and income, to really get a better picture of how we're situated when emergencies hit. And so in addition to SGBA+, we see the three key approaches that Lorraine spoke to depicted across the arrow that cuts across the diagram to really illustrate their needed integration across the emergency management continuum. And so those are gender transformative, trauma-informed, and equity-oriented. And you can see those being important to integrate across the 4 stages of the continuum, which are prevention and mitigation, preparedness, response, and recovery. And within those 4 stages, they are sort of depicted in the diagram here as the colors melding into one another. And that's really meant to represent that these stages aren't necessarily distinct and can be happening concurrently and acted on concurrently. And then we've also got this purple circle around the emergency management continuum, which represents the importance of community engagement processes that are inclusive, empowering, participatory, and community-driven. And so community engagement in emergency management is something that came up so much in what we read, as well as the folks that we spoke to, as really being key to developing emergency responses that are both well received, as well as having positive impacts. And it really can ensure that lessons are learned from each emergency and adjustments can be made, as well as tailored responses. And it really creates a stronger foundation for community-driven initiatives. And we can see that without community engagement processes being involved throughout the continuum, it is easy for responses to end up being misinformed or not addressing the specific needs of local groups and needs. So we believe that applying this framework will result in more equitable emergency management, as well as improve gender and health equity overall. And the framework can be applied to all emergency types, including pandemics, but also climate-related disasters such as wildfires and floods, and security-related threats and crowd-related disasters as well. And we also just want to mention that we know there are lots of frameworks out there for emergency management and integrating equity. And so we see this framework as really being complementary and something that can be applied alongside other frameworks. And so something we talked about a lot with our partners and consultation participants is how do we apply this framework? So we thought a lot about that, and really we're working on a report right now that really shows how it can be applied. So we see the GEM-F as being applied under 4 areas of action, and these are awareness and network building, planning and involvement, implementation, and monitoring and evaluation. And in our framework report, we're including lots of examples and resources and vignettes to really demonstrate the components of the GEM-F in action and indicate where you can learn more and have access to specific tools for very specific areas of the emergency management continuum and different approaches and ways to deepen your learning in each area. And throughout the framework report, we really emphasize Canadian resources, examples, and data where we can to make it really applicable and practical to our context. But we also include some exceptional international examples to inspire what could be. And so in the next few slides, Carol's going to go through an example of each of these areas of action in each of our areas of the emergency management continuum. So Carol, I'll turn it over to you.
Thank you, Ella. So yeah, in the preparedness stage, for example, one action related to awareness and network building might include that emergency management officials seek to identify, learn from, and form partnerships with community-based groups. These groups can be women's organizations, anti-violence organizations, community health centers, all with the objective that preparedness information reaches a wide audience, is delivered by these trusted community members, and is tailored to the groups they serve. And an example of a resource that we also highlight in relation to preparedness activities is the one that you will see on the slide about inclusive resilience, a socioeconomic vulnerability index to map flood risks for targeted communities developed by the Canadian Red Cross. In the next slide, in the response stage, an example of an action that can be taken related to implementation to increase sex, gender, and equity, or to integrate sex, gender, and equity considerations might include, for example, that emergency shelters address the biological and cultural needs of women and girls. And this can be by ensuring access to menstrual products, lactation support, safe sanitary services, and protection from all forms of GBV. And also, and Lorraine was speaking about this when we discussed the gender influences in the impacts of disasters, the importance that GBV and IPV services are recognized as crucial in emergency responses, along with trauma-informed mental health support. And you will see a resource there too that we highlighted, sorry, Ella, in the previous slide in response from Safely Fed Canada that talks about some of the preparations that emergency services can do to protect breastfeeding and mothers and children during the response stage. So in the recovery stage, those are also two actions that can be taken related to implementation, to planning and involvement, which include that advocacy groups are engaged in leadership roles and that they have the opportunity to highlight structural inequities and women's rights throughout the recovery process and the many processes related to this, that mentorship programs for women are well supported and operated by experienced leaders, and that representative of girls and women's organizations and interest participating communities engaged in recovery planning, implementation, and evaluation. And this is one example too of a resource that can be very helpful during to think about recovery processes about Indigenous women leaders in leadership roles in the fire management sector. And in prevention and mitigation, two examples of actions related to monitoring and evaluation can be that standards for quality care are developed so that the care sector is respected, safe, and secure in their work. And also that monitoring is measured related to the priorities laid out in the 10-year National Action Plan for Ending GBV and the calls for justice from the National Inquiry into Missing and Murdered Indigenous Women and Girls, as they are related to each specific sector. And again, a wonderful and very applicable resource that we highlight in that section was developed by Alex Valoroso and Carmen O'Neill. A toolkit for equitable emergency management. It's about integrating intersectional gender analysis into hazard risk and vulnerability assessment for local authorities. This is again to give you a picture of how concrete we try to be with examples of and specific actions and resources for ways in which the GMF can be applied across the phases of the continuum in 4 action areas. So the final section of the report is about indicators. And again, these indicators are also organized around 4 areas of action: the awareness and network building, planning and implementation, planning and involvement, implementation and monitoring and evaluation. The goal with our indicator development chart was to provide a tool that could be utilized to support both creation of indicators that are sex, gender, and equity informed, or adapt existing indicators to be sex, gender, and equity informed. So through the prompts that we developed there on sex, gender, and equity considerations, organizations can hopefully reflect on whether some existing indicators can be modified to kind of include sex, gender, and equity, or if they can come up with new indicators that actually are able to measure progress in integration of sex, gender, and equity. So one example that here in the slide, you will see an example from the chart with prompts reflection on whether women and girls from diverse backgrounds are being actively consulted to ensure their needs, priorities, and capabilities are fully understood and considered. And 2 examples of indicators that we provide there that we carry throughout the entire indicator chart is one quantitative example of indicator and one qualitative, showcasing that these things can be measured not only quantitatively, but also qualitatively. And that was also something that we saw throughout consultation, the importance of not only numbers and percentages on the impact of actions, but also collecting testimonies and narratives and stories from survivors and from affected communities. And that helps create a good picture of what is happening in the ground. On the next slide, there is another example. This one is on awareness and network building. For example, it can be considered whether leaders of emergency management organizations are receiving training on sex, gender equity, and trauma-informed approaches, and the ways this could be measured. Some example is the number of emergency management officials trained in SGBA Plus and in trauma-informed approaches and in gender and equity-informed approaches. And also, as a qualitative example, community testimonies on whether these trained leaders demonstrate greater sex, gender, and equity sensitivity. Another example related to implementation is to consider whether systems are in place to conduct rapid gender assessments at the outset of a disaster and to sustain these assessments during response and recovery. And ways to measure that, a quantitative one can be the number of individuals trained and experienced with SGBA Plus and disaster who can conduct these assessments and offer operational recommendations and that they are identified in the plans. And also a range of rapid gender assessment tools are part of response plans. And finally, in the monitor and evaluation key action area, a key consideration can be whether disaggregated data collection and reporting systems are in place to inform all stages of emergency management. And this could be measured by the percentage of emergency management programs that collect and report on disaggregated data, or examples of how disaggregated data is being used to shape emergency management strategies. And then again, this is all rounding up to how can the GMF can be applied and in ways also that are open for organizations to tailor these tools to their actual work and their resources and their capacity to implement and to monitor their progress in integrating the GMF. And I'll pass it over to Ella now to talk about two key organizations that are doing amazing work in the field that have been a reference for us.
Thanks so much, Carol. Carol just demonstrated some of the examples that you'll see in the GEMF framework that we are just wrapping up and finalizing, and it'll be available very soon. So we will follow up when it's available. But we wanted to just really highlight some of the exceptional work being done in this area. And Gender and Disaster Australia is really, as we said, a world leader on this and really helped shape our thinking as we developed this framework, as well as the indicator chart. That indicator development chart really came out of some inspirational work by Gender and Disaster Australia. And so they're a national level organization in Australia that's dedicated to research, training, and implementation of gender and equity in emergency management. So they've developed national level guidelines for integrating gender equity issues and emergency management, which comes with an actionable checklist. And they've also trained national emergency management personnel on the integration of these concepts, and have conducted extensive literature reviews on a range of topics, including the impacts on women, on men, and thinking about masculinities and the impacts that adhering to traditional masculinities can have in disasters. They've looked at the evidence on many intersectional considerations and have really led a lot of research on gender-based violence in the context of emergencies. They've also looked at long-term resilience building and how that can be facilitated, as well as Indigenous approaches to emergency management in the Australian context, and some women's leadership examples that have been really amazing in the Australian context. And then here in Canada, the Canadian Women's Foundation has led some work in this area, building off of some of the early work that happened here in Canada in the early sort of 2000s on gender mainstreaming across emergency management. So they've worked on including gender and social vulnerability into pandemic preparedness plans. So they've done sort of an analysis on how often it's included in existing preparedness plans, as well as looking at how gender-based analysis plus can be included in hazard, risk, and vulnerability assessments. They've also done some research around the COVID-19 pandemic and how governments at various levels responded to the rise in gender-based violence that we saw during that time. Additionally, they've also created some service continuity guidelines for the gender-based violence sector. So that's really a document that's supportive of thinking about how we can best prepare our essential gender-based violence organizations so that they can continue to operate during emergencies and disasters. And then they've also done some convening with various groups and various stakeholders to discuss prevention and mitigation in policy and practice. And we are really looking forward to working with them, and we've talked a bit with them about creating a network as we move forward on this important topic. So that sort of brings me into our next steps. We are wrapping up this project. It was a one-year project. So this sort of brings us back to our three project objectives. So as I mentioned, we are finalizing the framework now. And so we're just working on publishing the emergency management framework in a journal. And once that's published, we will have a framework report, the really practical version of the report available on our website for wide use and distribution. And then we are also working on some manuscripts based on our academic reviews. As far as building awareness, we've really been involved in working with folks at the JIBC and Royal Roads to present on the Gendered Emergency Management Framework to faculty, administrative staff, and students to really help think through how these concepts and how this framework can be integrated into emergency management education and curriculum. And then we also want to work on building awareness on this issue here in Canada. So we're going to talk about it a lot at various conferences and promote it on social media and our website, and really hope to enter into more conversations with folks about applying this here in Canada. And then back to the network. So yeah, we're continuing to connect with our partners and consultation participants. And we would love to, if any of you on the webinar today would like to be involved in a network on this topic, we would love for you to reach out to us. We really want to establish something here in Canada with our long-term goal is that we would hope to set up something similar to Gender and Disaster Australia, where we can really have a dedicated and formalized network on this issue here in Canada. And so, yeah, we just want to say thanks for coming today and thank you for listening to our presentation. We do have a bit of time for questions now, so I'm gonna stop sharing in a moment. The QR code for our monthly newsletter is up here if you want to sign up to hear updates on this project, as well as other projects that we're working on.